Hi, I'm Jeff Pickett, Marketing and Training Coordinator for HealthPOINT, your Regional Extension Center for South Dakota, and this is Decision Points, an interactive format to simplify your electronic health record journey. Our goal by providing decision points is to give you an informal breakdown of EHR-related topics so that you can better understand and make informed decisions. It's just another way HealthPOINT helps navigate you towards meaningful use. In this episode of Decision Points, we will focus on the milestones and timelines that CMS has put together that eligible healthcare providers must achieve in order to receive incentive payments for the meaningful use of certified electronic health records. Joining me today in this discussion will be Debbie Hoffman, HealthPOINT's Education and Outreach Manager. As we have traveled throughout South Dakota, we know that healthcare providers are at various stages in the implementation and adoption of electronic health records. But whether you are a provider that is on paper records or are a provider looking to upgrade your EHR technology, this timeline outlines key dates and deadlines.
Jeff, another benefit of the CMS timeline is that it helps healthcare providers maximize their incentive payments. Timing is a critical component of the incentive programs. Staying on track has financial rewards, so it's important to achieve each milestone.
That's a great point, Debbie. Well, let's start with the timeline. As I pointed out earlier, the timeline takes into account that you may have already implemented EHR technology. The first step is to utilize certified electronic health record technology. This newly implemented certification process began in the fall of this year. All EHR technology meeting the new certification process will be listed on the website of the Office of the National Coordinator shown here.
And that is a list that will continue to grow, Jeff. There are many EHR vendors that will go through the certification process and be added to the listing over the next few months. It's important that providers make sure that the vendor they select is certified for future opportunities and integration with other systems.
Okay, well, if we get back to the timeline, each provider must register to be eligible for the incentive payments. The registration process will be posted on the CMS website in January 2011. If you're an eligible provider with a certified EHR and have registered with CMS, attestation of meaningful use for the Medicare EHR incentive program can begin as soon as April of 2011. So Debbie, what happens with providers that have not selected their EHR system?
Jeff, all providers still have the option of qualifying for the incentive payments for fiscal year 2011. If a provider qualifies for the Medicaid incentive program, they simply need to demonstrate that they have either adopted, implemented, or upgraded certified EHR technology during 2011. If a provider qualifies for the Medicare incentive program, they will have to attest to meaningful use of their EHR technology for 90 consecutive days during 2011. This means that providers on the Medicare incentive program must be ready to go live and utilize their EHR beginning October 1st, 2011 to get 90 days in for 2011. Then they may complete their registration and documentation by February 29th of 2012. Therefore, providers will still be eligible for the 2011 payments.
As you can see, the timeline after 2012 is much broader and less defined at this time because the Stage 2 and Stage 3 milestones for meaningful use have not yet been established. The last year to register for the Medicare Incentive Program is 2014, while 2016 is the last year to register for the Medicaid Incentive Program.
You know, Jeff, while the requirements for the incentive program are not yet defined beyond 2012, one thing is clear. In 2015, Medicare will begin payment reduction for those healthcare providers not utilizing certified EHR technology. I think you'll agree, to maximize incentive payments and eliminate reductions, it's very important providers consider EHR implementation and adoption as quickly as possible.
I agree, Debbie. It sounds like timing really is of the essence for providers. And if they want to know how to take the next step, this is where HealthPOINT is a resource to help get them started.
If you have any questions that we have not addressed in this presentation or would like more information, please email me at debbie.hoffman@dsu.edu or visit our website at www.healthpoint.dsu.edu.